Hi, my name is Ann Douglas, and I'm an assistant professor of early care and education at the University of Massachusetts, Boston. I conduct research on child care quality improvement and professional development with a focus on organizational change, leadership, and policy. I also direct our early childhood bachelor's degree program and a new postmaster's certificate program. Before I came to higher education, I worked for 15 years as a teacher and director in urban child care programs, so I bring a strong practitioner and community-engaged perspective to my work. I'd like to make 2 points. First, we must focus more on the workplace context in our professional development and quality improvement efforts. There's a gap between our efforts for higher quality child care and the persistence of low quality child care. We need to develop the evidence base for quality improvement and use the organizational science research to better understand what it takes to move the mark on quality. We know that professional development has little impact when it is disconnected from the everyday practices where teachers work. Yet the workplace context has received little attention in the early care and education research. There's compelling evidence from other disciplines that a positive workplace context is essential for quality improvement and the transfer of learning to practice. We've long known the central importance of caring, of safe, stable, and nurturing relationships for healthy child development and learning. What we can learn from organizational science research is that caring workplaces are just as important for adult learning and for improved quality outcomes. There are models for improvement that promote both evidence-based teaching practices and also promote the kind of workplace environments that enable improvements to happen. The key ingredients in these workplaces include high-quality relationships with shared goals, shared knowledge, and mutual respect, along with psychological safety in the workplace and effective leadership. One such model that has been used widely in the healthcare context is the Breakthrough Series Collaborative from the Institute for Healthcare Improvement. This continuous quality improvement model supports and engages organizational teams in a learning and improvement process. Very recently, this model has been introduced in the early care and education context. We're studying a Boston collaborative now focused on improving trauma-informed practice in urban child care centers. So my first recommendation is to develop this evidence base and a research agenda that includes the workplace context as an essential element in quality improvement. My second point is that we need to establish advanced leadership pathways in higher education to meet the urgent need for faculty, scholars, and leaders in the field with early childhood expertise. There are many gaps between what the field needs and what currently exists in higher education. As states have increased requirements for early educators to have college degrees, the lack of sufficient higher education programs and appropriately qualified faculty to teach in those programs has become evident. At UMass Boston, we launched a bachelor's degree program in 2009 designed to meet the needs of the workforce. We started with 15 students, and now a few years later, we have over 200. Many of them benefit from our state's early educator scholarship. One of the most pressing needs is for early care and education leadership development, and that includes doctoral programs that focus on birth to 5. Doctorally prepared leaders are needed for multiple roles as teacher educators, researchers, and policy experts. With funding from the Massachusetts Race to the Top Early Learning Challenge Grant, UMass Boston developed a postmaster's certificate program in early education. To be eligible for this program under the grant funding, applicants must have a master's degree and work directly with children birth to 5. This leadership pathway supports those from within our diverse field, the most diverse workforce sector in all of education, to pursue advanced study that can prepare them to apply to a doctoral program or to pursue other leadership activities in the field. This program has been a success, and we have now extended this work with a proposed PhD program. In summary, I urge the committee to support the development of higher education pathways that include doctoral study. A personnel preparation funding stream could provide dedicated funding both to support students and to support improvement in higher education program content and quality. As one student in our postmaster's program expressed, unlike many other professions, in early care and education, it is difficult to continue to grow as a professional. Experienced teachers often do not have opportunities to learn. They hit a plateau. We have an opportunity to change this, and we should. So to conclude, I have recommended a focus on the workplace context for quality improvement, as well as support for advanced leadership pathways in higher education. Thank you very much.